Meet Garima and Dan Jones. They're a happy couple and just learned that Garima is pregnant. This means they have many things to prepare, plan, and worry about. Dan, as a father-to-be, is very protective of his wife and the baby they're expecting. He wants to make sure his wife and the baby get the best care possible. He ensures that his wife is eating well, has time to relax, and has nothing to worry about regarding their future lives with the baby. But is that everything? During the first visit to the obstetrician at 10 weeks, they hear for the first time about pre-eclampsia. Though pre-eclampsia is not a rare disorder, as it affects up to 6% of pregnancies worldwide, it is not well known. Every year, about 10 million women around the globe develop pre-eclampsia, and over 2.5 million preterm births are due to pre-eclampsia. Their physician explains to Garima and Dan that through a very simple procedure, it's possible to predict and then act to prevent pre-eclampsia. This procedure is painless and safe for both Garima and the baby. First, the obstetrician collects some personal information about Garima. Then the obstetrician measures Garima's blood pressure while Garima is sitting comfortably in her chair. The obstetrician then proceeds with an intrauterine Doppler. Garima can walk with her husband to the closest lab for a blood draw. The blood will be analyzed for a specific marker. All the data is used to assess Garima's risk of developing pre-eclampsia later in her pregnancy. A few days later, Garima and Dan return to the obstetrician. It turns out that Garima is indeed at a high risk for pre-eclampsia. Dan feels very stressed and powerless. However, as the obstetrician reminds them, pre-eclampsia can be prevented. A landmark study has shown that a daily low dose of aspirin starting before week 16 and taken until week 36 can significantly help prevent preterm pre-eclampsia. Dan reminds Garima to take the aspirin every day at bedtime. This is when the treatment is most effective. Congratulations! It's a baby girl. Good job, Garima. You made it with the help of Dan. While you may have a million things to worry about during your pregnancy, pre-eclampsia doesn't need to be one of them.